So what kind of post-surgical restrictions or contraindications does a patient have after FAI surgery with labral repair and cam reduction? Okay. So these are restrictions based on anterior-superior labral tears. And this is going to be the large majority of labral tears within the hip. But just keep in mind, these will probably change up a little bit if it's going to be a tear in a different location. Okay. Generally speaking, these are all general recommendations. Okay. Don't take my recommendations blindly. Speak to the physician, see what the protocol says, and follow that. Okay. That's going to be very, very important. Generally speaking, range of motion is going to be restricted for around 3 weeks. Okay. So, in terms of flexion, this is most commonly going to be restricted, and it's usually restricted somewhere around 90 degrees. Okay. The reason being is if you go into hip flexion, you're going to compress the labrum and make some bony contact between the ball and socket. Okay. Keep in mind, we just repaired the labrum and we just shaved down the bone, right? Bone is sensitive. So, if you take someone to a bunch of hip flexion early on, you can really aggravate the front of the hip. Okay. We'll talk about this later, but we really don't want to have that happen early in surgery. The other motion that's going to be limited is internal rotation range of motion. Okay. So cam morphology within the hip limits hip internal rotation because the ball will bump up against the socket when you go into hip internal rotation. Now, they just removed that cam morphology. So for a lot of patients, they actually have increased range of motion after the surgery than before because they got rid of that bony block that was restricting the rotation range. All right. But here's the thing. If you go into hip internal rotation, you're starting to contact those freshly repaired joint surfaces, which is probably not a good idea early on. So you're going to see limitations to internal rotation. Okay. You also see limitations in external rotation, usually around 30 degrees, and extension, as well as abduction. All right. I think it's a good idea not to go to end range in any particular motion. But the reason why these directions are limited is because when you go into external rotation and extension, a little bit with abduction, you're going to stretch the joint. Okay. You're stretching the fresh surgical repair of the labrum. So early on, we don't want to stretch that too much. We want some scar to lay down. We want to have some healing occurring. So early on, you don't want to push these ranges. Okay. What I will say, and this is anecdotal, is that most of patients' range of motion comes back over the course of time. This is not a surgery where you have to be aggressive about getting that range back. Okay. This is not a Bankart repair in the shoulder, right? This tends to get better with time. This is not a total hip replacement. We don't have to go cranking on the hip joint. Usually things get better over the course of time if we don't make the area angry. And if anything else, you remove bone with this surgery. So in theory, you're actually increasing the range the hip has. Okay. And one of the biggest reasons why we don't push into end range motion is because we can definitely have some increased inflammation within the hip joint. Now, I don't know that we have this figured out entirely, but suffice to say, you can very easily make the front part of the hip joint very, very mad if you do too much too soon. And this goes from a range of motion as well as a strength perspective, especially doing a lot of hip flexion strength. And we'll talk about some of the contraindications to this a little bit later. But I've had multiple surgeons tell me that if the hip joint gets too irritated, they may have to have some sort of debridement surgery to get rid of some of that irritated tissue over the course of time. What I will say is that if you don't follow this kind of precaution, you can get the hip excessively sore, which is going to limit your progress moving forward. Okay. So definitely want to make sure you don't push the range of motion too much early on. There's no real reason to do that. This range of motion will come back over the course of time if you're smart. Okay. The next restriction that you're going to come across is going to be a weight-bearing restriction. Now, this is going to depend largely on the surgeon that you're dealing with, right? The surgeons I work with usually like some sort of non-weight bearing or toe touch weight bearing for the first 3 to 4 weeks, right? I've had some local surgeons that are okay with partial weight bearing from the very beginning, right after surgery. Largely, it's going to depend on the surgeon. So make sure that you know what your surgeon wants before you go willy-nilly with weight bearing status, all right? The other thing to keep in mind is that if you have a microfracture procedure, it's going to slow things down. So generally speaking, for the first 3 to 4 weeks, surgeons are going to want some sort of partial weight bearing or non-weight bearing for non-microfracture procedures. And then for the microfracture procedures, you wait closer to 6 weeks. All right. But what I will say is that there's a lot of variance between surgeons. So just make sure that you know what you're dealing with what the surgeon wants, so that when you refer the patient back and they go back to their follow-up visits, the surgeon isn't really mad that you did something that they didn't want you to do, right? That's not a good thing. Another restriction or contraindication that you'll see early on is sitting. And this is not something that you can't do, but you don't want to do too much sitting over the course of the day. That just compresses the front of the hip joint. It can lead to irritation. So usually you want to try to reduce the total amount of sitting that you're doing, okay? And also not sit so that you're extending past 90 degrees. The next one that you have to be really cautious with early on is going to be hip flexion, active hip flexion. So trying to lift the leg yourself. This, again, is surgeon preference, but oftentimes there's going to be a contraindication for how much motion you can do into hip flexion, as well as how much you can actively lift your own leg, okay? So some docs don't want you to lift the leg at all yourself for the first 4 weeks, all right? Thought process is that maybe some of those hip flexors are tugging on the labral repair, causing some irritation in the front portion of the joint, okay? And that can lead to some trouble over the course of time, okay? Again, if we do too much hip flexion, that can cause irritation, and that can reduce our progress moving forward. It can also set us back, so we have to be really cautious with this, okay? So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.